Morning.
I didn't know you were up.
Oh, you know, seize the day and all that.
I reckon these look nice out the back. Add a bit of colour. Am I missing something?
I thought you were going to register with the doctor's surgery.
I didn't think you meant today.
We've been here 2 weeks. We're supposed to have regular checkups. Stephen, did you hear me?
You just look so tired, love. Why don't you go back to bed, eh? You can register next week. You don't have to do it today.
I've been shut up in this house since we got here.
I just don't want you to push yourself, that's all.
I'm not. Besides, this one's not going to wait around.
It's supposed to be my day off, you know. That's why I'm doing stuff from the house.
I know, but...
The baby, yeah, I know. I'll take you later, okay?
Oh, don't bother. Find my own way.
Gosh, didn't realise we had so much stock.
Impressive, isn't it?
Well, it's a good job we haven't got any patients today. I mean, when you said reorganise, you really meant reorganise.
Never done anything by half.
I'll say. Gosh, you even made a plan.
So?
That's just that I would have done the same.
Oh. Was there something you wanted?
No, I just, wanted to make sure that everything was okay, actually.
Right.
After yesterday.
Well, it is.
Well, that's great. I'll leave you to get on with it then. Keep up the good work.
I will.
Linda, wait!
I'm all right.
Linda, hold on. I just wanted to say
What?
that...
You want to what, Stephen?
I just wanted to apologise. You caught me off guard, that's all.
Fine. Apology accepted. I'll see you later.
Don't you want me to come with you?
Not really, no. And I can find my own way home too, so just go home, Stephen, okay?
You're trying to do too much, love.
I'll survive. I just want to get this done. I'm okay, really. So just let me get on with it.
You could call me, I'll come and pick you up.
Stephen!
What?
I don't need this. I know you're only trying to help, but it's too much. It's smothering. I'll see you later.
Okay, just take a seat for me. Thank you.
Oh, sorry.
Jimmy, don't do that to me.
Listen, about yesterday.
Yeah, look, I'm really busy today, so I'm not sure I've got time to listen to all of you.
Yeah, well, I did go on a bit, didn't I?
Maybe just a tad.
Oh, thanks for listening. You won't say anything about... Well, you won't tell the others.
Completely confidential, Jimmy. We've all agreed that.
Of course. Well, maybe we should make some time later, though.
Really?
Yeah, well, I really didn't think that you got a chance to talk about what you want, you know, where you're at in life.
Yeah, but do you know something? I really don't feel the need.
Well, I find it very helpful. Helped me consolidate where I was going in life.
Well, with the greatest respect, Jimmy, you're single and you're a man. And it was a great opportunity for you to talk about yourself and where you're going in life. But I've got friends and a husband to do all that with, so it's a lovely, lovely gesture, but I think I can survive without a rematch.
Okay, well, for sure.
Yeah. Can I help you?
Hi, my name's Linda Miller. I'm new to the area. I'd just like to register with the doctor.
Well, just in time. When are you due?
I've got a couple of months yet.
Are you okay?
I've just given myself a bit of a stitch. I think the walk was a bit far.
Well, you've got to take it easy in your condition. You can't go on as you used to.
Do you think I could see somebody today?
Of course.
Oh, look, you really don't look too well. Oh, well, it's okay. I'm a doctor here.
Sorry, but I'd rather see a woman.
George?
House calls. What about Michelle?
Yeah, good idea. Michelle, there's a woman in reception needs to see you.
I'm not seeing patients today. Can't you see her?
Oh, well, she'd rather see you. She's pregnant.
My room's a mess.
Well, then we'll use mine.
OK, we're going to go and take you to the nurse. Her name's Michelle Corrigan. She's lovely. OK?
a stitch. I walked here, it was too far. You don't think it's the baby?
I think we need to take a look at you.
Well, I'm not sure.
Dr. Clay's just here to offer his advice. So where does it hurt?
Here.
And when did you first notice the pain?
Last night. I just thought it was something I'd eaten.
It's okay if I take a look. Is that sore? And here?
Yeah.
Okay. When did you last see a doctor?
About a month ago. I've just moved to the area. I hadn't registered with anyone yet.
Does it hurt more when you go to the toilet? And the pain, is it at the front or the side? You said you thought it was a stitch.
Well, it's all over. But it's not as bad now.
Well, why don't we check on the baby, as you're here? How are you in general?
Okay. A little tired.
Any sickness, diarrhea?
There you are. Strong as an ox, can you hear?
Yeah.
Oh, your baby's as fit as a fiddle.
So there's nothing to worry about then?
Not with the baby, no. But we're starting to find out what's causing you pain.
Oh, I'm sure it's nothing.
Well, maybe. But pain should never be ignored, especially in your condition. Dr. Clay, any ideas?
Well, it could be a bowel or a bladder infection. Have you had your appendix out? Could just be an upset tummy. The thing is, we need you to have some proper tests, so I'd like you to go up to the hospital for a checkup.
The hospital?
Just to be on the safe side.
But I thought the baby was okay.
The baby's fine. We just want to make sure that you're all right.
Okay.
Right. Well, I'll ring St. Phil's and let them know you come in.
I'm sure everything will be fine. St. Phil's will take very good care of you. I'll leave you to finish up.
Thanks, Dr. Clay.
Sorry, I'm looking for my wife.
Your wife?
Yeah, Linda Miller.
Oh, yes, she's in with the nurse at the minute.
The nurse? Why is she with the nurse?
Everything's all right. She just had a bit of a turn. So
A turn? I've been sitting out there for 20 minutes. Where is the nurse?
Mr. Miller, if you just come...
Linda?
Donna?
Yeah, this is Mr. Miller. His wife is in with Michelle.
OK, well, Mr. Miller, if you'd just like to keep calm.
I am calm. I just want to see my wife, all right?
I'm sure she's fine.
No, you don't understand. I need to see her. She needs me.
OK, right, well, I'll go and see if she's finished with Nurse Corrigan then.
I'm sorry about the way I acted. With Dr. Clay, I mean. He just gave me a bit of a fright, that's all.
That's okay. He has that effect on most of us.
No, it's just... A few months ago, I was mugged. It's been a bit of a struggle, you know. Getting back to normal.
Sorry to interrupt, Jimmy said you were in here. It's just that Mr.
Linda? What's happened? Are you okay?
Mr. Miller, please.
I'm fine. I thought the baby was coming, but I'm fine.
The baby.
The baby's fine. Would you like to take a seat? Thanks, Julie. Everything's okay.
What about Linda? What's wrong with her?
Nothing.
Your wife just had some abdominal pain.
Is that true? Well, is it serious?
It's probably nothing, but we'd like her to go to the hospital just for a few tests.
Just to be on the safe side.
I see.
All right?
Right, hospital. We'll go straight away. Sorry for barging in. I overreacted a bit. With Linda's condition, you know.
Well, no harm done.
I thought she was coming in to register her. I didn't know she wasn't feeling very well.
So you're off to the hospital now?
Yeah, straight away.
Well, we'll call and let them know. Don't worry. St. Phil's will sort you out. You give me a call and let me know how you get on.
Yeah.
We'll call you the minute we know anything, all right? Anyway, we'd better get going.
Thank you for everything.
You're welcome.
Right, come on then. Thank you.
Expectant fathers, eh? They're all the same.
Linda, wait.
No, I won't let you. You're not going to harm my baby.
What are you talking about? I'm only thinking of you. Now, just stop it. You're being hysterical.
Don't touch me!
Linda! Linda!
Mrs. Miller?
I need to see Nurse Corrigan.
OK, take a seat for me.
No, please, I need to see her now. It's an emergency.
All right, well, don't worry. Just take a seat and I'll get her for you.
Linda? What's happened? What's the matter?
Please, you have to help me. They want to kill my baby.
What?
Call St. Phil's.
OK, now calm down. Tell me what's wrong.
It's Stephen. He says I have to have the operation, but he knows the baby will die. Please don't let him. Don't make me.
Why don't we go to my room? You can sit down and we can get to the bottom of this.
Do you want me to call your husband?
No, please don't tell him. He'll make me go back.
We won't do anything they don't want us to. Now calm down and let's go to my room, OK? OK. Here you are. Have this. So what happened?
They did some tests and said I was sick and need an operation. I wanted to know about the baby. They said the baby would die.
Are you sure that's what they said?
Stephen said I had to have the operation. He wasn't going to let me leave.
But why would Stephen want to harm the baby?
He hates it. He's been trying to get rid of it since we found out. He wanted me to have an abortion. Sometimes I think he'd like me to have an accident just to get rid of it.
Has Stephen ever tried to hurt you?
Oh, no. No, he would never. He loves me.
But yet he doesn't love the baby.
Well, I couldn't tell him about the pains. I thought they were contractions and the baby was coming. I didn't want him to know, but there's nothing wrong with the baby. You said so.
That's right. There was nothing I could see. Can you remember what they said was wrong with you?
Appendicitis.
Appendicitis, are you sure?
That's what they think it is. But what if they're wrong? They want to operate, but what if they're wrong and my baby dies?
OK, well, Dr. Clay's calling the hospital now. Why don't we talk to him and find out exactly what the problem is? No matter what happens, I'm not going to let anyone do anything that you don't want. And I'll be with you every step of the way, Linda, OK? Now try and calm down. All this stress isn't good for the baby, is it?
Linda? Linda?
You have no new messages.
It's suspected acute appendicitis.
Suspected.
Well, they're concerned that it can develop into peritonitis. That's when the infection spreads to the peritoneum. If that happens, it can be extremely dangerous.
But you said suspected. What if they're wrong?
That's always a possibility. Diagnosis is very difficult, especially in your condition.
But you are showing all the classic symptoms. There really isn't any other option.
But it will kill my baby.
That's not true. There's always risk with surgery for both you and the baby. But the chances are very good that you'll both be fine.
The majority of patients make a full recovery with no complications.
So you see, it really is the best thing for both of you.
But what if something goes wrong? I mean, being pregnant makes it very dangerous, doesn't it?
Yes, there is a chance you go into premature labour.
But that's only in the worst case scenario. You have to be positive, Linda. Trust the doctors at St. Phil's.
But can't I wait till after I've had the baby? I mean, that's what they normally recommend, isn't it?
Well, normally, yes, but this is very serious, and the risk to both of you if you just leave it is very high. That's why surgery is the only option.
Look, you know that we wouldn't force you to do anything that wasn't entirely in your best interests. If you don't have this operation, you could easily lose this baby or even your own life. And I know you're scared, but you have to be strong.
Will you come with me?
Yeah, of course I will.
Linda? Where's Linda? Back to the hospital. Yeah, all right, I'm leaving now.
Don't worry. Everything will be fine.
Where have you been? I've been worried sick.
I had to talk to someone. Someone who'd listen.
You should have called me sooner. The minute she got to the surgery.
Linda asked us not to. We respected her wishes.
Her wishes? I've been at my wit's end. Who do you think you are, anyway?
I'm having the operation.
Thank the Lord.
And I'm having this baby.
I don't want to talk about that now.
But we have to.
No, we don't.
I think you should.
This has nothing to do with you. Just stay out of it.
No. She's listening to me. To what I want. She wants what's best for me.
And I don't want what's best for you? I don't care. Is that it?
This is very difficult for Linda, Mr. Miller. Doctor will be here soon. He'll talk you through the procedure and make sure you're ready.
You are staying, aren't you?
Yeah, of course. So anything you don't understand or anything you need, just ask. In the meantime, I really think that you two should talk.
Talk?
This is a very serious operation and Linda is pregnant. All this stress isn't doing any good at all. Talk about things. You'll feel better. Both of you.
She wants a few moments alone. Why didn't she just have the abortion? None of this would have happened.
How can you even say that? Okay, why don't you want this baby?
I don't think it's any of your business.
Maybe. But you better start facing up to some home truths. This baby is going to be born whether you like it or not. Even if Linda wanted an abortion, it's too late for that now. So you better be ready. Because she needs you.
Needs me? You have no idea.
Don't I? Linda told me you hated the baby. Is that true? How can you be so cold? Don't you care what happens to her?
Of course I care about her. I care more than you'll ever know.
But she's having your baby.
No, she isn't. Yeah, now do you get it? Happy now? Linda was raped. That thing inside her is his. Not mine.
Linda? You okay, Linda?
This is all my fault.
Go and get some help.
Oh, please don't let my baby die.
Just try and keep still, okay?
You sure you should be doing that? You mess up her sister.
No, I won't. She left me a map.
Making amends.
Yeah, something like that. Anyway, she's got enough to worry about.
Has anybody heard from her, from the hospital? No, she's okay.
She'll be fine. She's on a mission. You know how tenacious she is.
We're here. How's Stephen?
He's waiting outside. Feels guilty. Blames himself for making you worse.
He always does. You mustn't be too hard on him. It's not his fault. He's told you. We couldn't be sure. Not absolutely. We try to pretend it's ours. We both know that's not true. Every time the baby's mentioned, I see a tiny stab of pain behind his eyes. It's been so hard on him. He's been a rock to me.
Didn't you consider having an abortion?
1,000,000 times. I just wanted something good to come from all this. Something right in all this wrong. Does that make sense? Thanks for seeing this through. Could you get Stephen for me?
Yeah. Come to show some solidarity?
Something like that. How's everything?
Not good. There were complications. Linda went into labour. They had to perform a cesarean.
Really?
Yeah. They've moved to the high dependency unit. The next few hours will be critical.
Right, I'll wait with you.
Thanks. Linda's a strong lady. You're both strong. Look, I know the past few months have been terrible for you, but you have to hold on.
Why us, When does it end?
I don't know. But you have to have faith. You'll get through this.
I've no faith left.
You have a baby girl. She's premature and will need all the care she can get. But there's hope. You have to take comfort in that.
Oh, a precious little miracle.
Don't.
Why didn't she get rid of it? That precious baby might be the thing that...
Don't. Let him cool off.
I don't think he can.
He will. Right now he's confused and scared. He doesn't know what to do.
It's a miracle they've made it this far.
Really?
Hey, thanks for the moral support.
It's the least I could do. You know, you've done a good thing here for them.
Oh, they just needed a friend.
Oh, well, you're a good one.
Oh, stop it. Look, I better go after him.
Okay.
Beautiful, isn't she?
So small. Fragile. Sorry for storming off like that.
No need to apologise. Have they said anything more about Linda?
The doctors say she's pulling through. They think she's going to be all right.
Well, that's good news. And what about you?
Me?
Linda told me you had to be strong for her. Can you be strong for yourself?
I don't know.
Linda made the decision to keep the baby. I know that must have seemed insane to you, but in a way, she did it for you. For you both. She didn't want you to go through life thinking of the pain. She needs this baby to give her hope.
I don't think I can ever look at the baby and not think of the rape. Never.
Don't say that. You have to understand why Linda made the decision she did.
I can't.
You have to. This baby is an end to all the bad times. A fresh start. A new beginning.
Is it?
Yes.
Lessons in life and love tonight on BBC1. Tom's relationship hangs in the balance at Waterloo Road at 8. Next this afternoon, a highly contagious diagnosis murder.